Yeah.
Hello sir, good
Hi.
morning.
Hi. Good morning.
Happy Doctor's Day.
Thank you.
Welcome to Kakas International School.
Thank you.
I am very glad to see you here and I really appreciate your work. My name is Mansi Nanaba Survase from 7th standard. Today I am very excited to look into your job, your profession, your field. So may I?
Yeah, please.
Thank you sir. So sir, would you like to tell us that how did you choose your medical specialty?
See, how did I choose? It's nearly 15 years back. Okay, when I cleared my 12th, I was interested in biology. Basically, you need to select in 10th itself that whether you are interested in like CA or engineering, or you want to become a doctor or some biology field. So I have pre-decided. My uncle, my elder brother, all are doctors. So I've seen hospitals, I've seen doctors, how they work. So because of that, in 11th only I have taken biology and then gone ahead with that.
That's great.
Yeah.
What do you think patients misunderstand the most about doctors or healthcare?
See, this is excellent question. They misunderstand a lot of things. I don't know how to explain to you at this age, but doctors never see after studying so much. You're giving 10 to 12 years, 15 years of your life. Okay, so no doctor will harm any patient. So whatever according to their knowledge, they'll treat the patient. Knowledge can be less, can be more. That depends upon their practice. Okay, but jaan bujh ke, they'll not harm any patient. So that should be understood by the patients or relatives and all. And the patient condition can go in any direction. First of all, we are not God. We have learned science and we are applying science. Okay. So after applying science, how the body is responding, okay, how the patient is responding with the medication, surgery or whatsoever. So it can go to any direction. It can get better in a day. It can take 1 month to get better. It may never get better. So there are few patients which never get better, or some patients unfortunately they die also. Okay, so they need to understand this thing that we are not God first of all. Okay, we are applying the science and we are giving our 100% to save the patient, and then it can go anywhere. Okay, so that bit they need to understand. And I hope you also understood.
That's great. So would you like to tell us more about telemedicine?
Okay, so yeah, the telemedicine is a newer concept. So basically, first of all, you should know that there are very few doctors when we compare to the people or patients. Okay, so we have one doctor for 2,000 people. You can understand how like one doctor is seeing 2,000 patients. If you calculate the population and you calculate the number of doctors, the doctors are this less. So what is the solution of this? A doctor cannot go everywhere. So telemedicine is a good thing. Telemedicine means nowadays they can just go to the website, they can dial video call or audio call or text message, anything. So with that they can get the expert opinion without meeting personally to doctor. A doctor in America also can treat the patient to some extent who is sitting in Pune, okay, or in two corners of Pune. Patient is in one corner, the doctor is in another corner. So they can treat like that. It's a very beautiful thing, beautiful concept, and there is no harm in doing that. But it should be to some extent. A sick patient and you are continuing your telemedicine, it should not be happening. You need to examine. Examination of the patient is also important. You need to touch the patient. You need to examine the whole body from head to toe. So that is also important. But some decision can be taken through telemedicine.
So is that good or how?
It is good. So see, there is a good and bad side of everything. Okay, this is a good side. What I am saying that people are getting expert opinion. Okay, in a village, if someone is there, they can just go to the website, dial my number. I have a website. They just go to the website, dial my number, and they can do a video call. Some minimal charges they have to pay, and they can do a video call. So you can imagine, I am sitting in Pune and some rural place, a sick person is there. I can help them through telemedicine. But I should be in control. Okay, it's not only telemedicine. If I feel the patient requires a visit a personal visit, then I'll say clearly, no, it cannot be managed in telemedicine. You have to consult a doctor physically. You have to go there and consult them. So doctors should know where to stop. Okay, everything cannot be managed by telemedicine. It's a bad side of it.
That's so sometimes I can't understand that what will happen to me if I miss any dose.
Okay. See, there are different medications, different repercussions. Okay, so if you miss an antibiotic, that's not good. Okay, see, antibiotic work after 2 to 3 doses. If you are taking 2 doses and you are feeling better and you will stop taking medications, antibiotics, and what will happen? See, there are 1,000 organisms are there. Okay, for our understanding, let's say there are 1,000 organisms. You are taking that 2 doses of antibiotic and then stopping it. Your symptoms have improved. But why it is improved? Because from 1,000 it has become 100. Okay, but if you stop taking medication once you are feeling okay, what will happen? Again that 100 will become 1,000 and lakhs and 10 lakhs. So this should not happen, and they know the medication now. So now the new organisms which are there, they'll not respond to the old medication which you are taking. So we need to be a step ahead. तो दूसरा medication देना पड़ेगा. You should never do. What a doctor says, 5 days of course, 10 days of course, you should take it. Okay? Especially it is important in antibiotic.
From onwards, I will not miss any dose.
Very good.
So, what's one thing you will suggest us that every person should know about their healthcare, as health is wealth?
See, the most important thing is prevention. You should need doctor as less as possible. We all intend to do that, right? But we don't take steps for it. Okay, there are simple steps you need to follow. Okay, we all discuss good food, hygiene, keep the surrounding clean. Okay, and go if at all something is troubling you, go early to the doctor. Don't hesitate. I'll wait for 48 hours, I'll wait for 72 hours and then go. Don't do like that. Okay, so precaution is the main thing you should know, and be healthy.
Hi sir, my name is Ishwari. I'm from 7th grade.
You are Mansi.
Yes, I'm Ishwari. I'm from 7th grade. First of all, happy Doctor's Day.
Thank you.
I want to know your opinion as a doctor. So can I ask some questions?
Yes, please.
Thank you, sir. So at first, I want to know that how did it feel when you treated your first patient?
Okay. See, individually it's very difficult. See, we for 10 to 12 years we are all studying, so we are under someone. Okay, so it's their decision, their patient, everything. We are just helping them and getting to learn something. Okay, so first patient, if I remember, was a dengue patient. Basically, I had initially done my MBBS, then I had interest in pediatrics especially. Then I did my pediatrics MD for 3 years, and then in that MD I had one patient, dengue, a child, some 8 to 10 year old child was there, and it was very critical. She almost the seniors have also given up. She cannot be survived. But me and my colleagues, the junior ones, we stayed there all night and tried to do something. Somehow the child could be get better. Okay, though the chances are very less because seniors have given up. They know better than us. Okay, so but what happened, miracle or our effort, we don't know. But morning the improvement was there, and she later, after 6 to 8 days, she survived and discharged and went home.
Yeah,
Okay.
it was a great experience.
So yeah, such experiences helps you to move ahead, do better in the field.
Can we move to the next question? How much time it takes to become a doctor?
So see, it depends what doctor you want to be. Okay, so MBBS is also fine. Okay, our country needs MBBS doctor. Okay, in the rural areas, in the PHCs, in the government setup, anywhere, people need MBBS doctors. So MBBS takes after 12, it takes around 5.5 years to finish your MBBS. Okay, and then if you are still interested in studying further, you can do a specialty. Okay, so for that you need to give an entrance exam. Okay, which is all India exam. So that entrance you have to clear, and then you go ahead to a specialty. The specialty means your gynecology, pediatric, then skin doctor, dermatology. So all the different specialties. You can select one of your interest and go ahead in that. And then again, if you are much more studious and want to study more, then there is subspecialty. So there are cardiac surgeons, okay, pulmonologists are there. Then as I'm an intensivist, okay, I take care of ICU. So if you want to study more further, then more 3 years you have to devote. So overall, not less than 10 years, but it can take up to 15 years.
Thank you, sir. So my next question is, what's the most rewarding part of being doctor?
Smile. है ना? Especially in my field. Imagine a child is coming, crying or unconscious and lot of trouble. Okay, fathers are also equally tensed, equally they are worried. And then after a few days, all are smiling. You feel good, na? This is the reward we want.
Shifting the gears bit, can we discuss if you weren't a doctor, what would you be doing now?
If I am not a doctor,
Yeah, if you would means you were not doctor, so what would you be doing now?
okay, I never thought of that. From age 15 or 16, I want to become a doctor. So it's, see, my father has a business and he earns a lot. I know that. So maybe I'll go in that business. Yeah.
You would be there in your father's business.
Yeah.
Interesting. Let's talk about the most interesting case you have encountered recently.
Okay. So recently, when I came to Pune, okay, I finished my study in 2024 from Chennai Apollo, and then I came to Pune. Joining Manipal, and second day there was a child called Anushri. She is a 3-year-old child who fell from second floor from the balcony, and there was lot of bleeding, lot of hemorrhage, lot of fractures, and she was unconscious, pretty bad shape. And then cut to after 15 days, she was all discharged with all, like, no deficit, all healthy. She was discharged. So that is one case which fuels me.
Yeah, that's great. Thank you, sir, to give us your precious time.
Thank you. Thank you.
One
Thank
so
you.
happy doctors.
Thank you.